Do you have a loved one critically ill in intensive care, and are you looking for support? I know it can be hard, difficult, and extremely frustrating because you don't know what you need to do. This is why I created the intensivecaresupport.org membership for families like you who have a loved one critically ill in intensive care. Hi, I'm Patrick Hutzel, an internationally experienced registered intensive care nurse and founder of intensivecaresupport.org membership, the world's greatest place for families who have a loved one critically ill in intensive care, who don't know what to do, and who are looking for expert and peer guidance and support. When was the last time you got access to a high-grade community, tailor-made solutions, and nearly 20 years international intensive care experience to help you get results and outcomes when you have a loved one in intensive care and you get it all for less than $1,000 per year? Here you can get access to the intensivecaresupport.org membership for only $97 per month or for $799 per annum. The intensivecaresupport.org membership is the greatest place on earth if you have a loved one critically ill in intensive care and you are looking for support because you don't know what you need to do. After having worked in intensive care nursing for nearly 20 years in 3 different countries, where I literally worked with and looked after thousands of critically ill patients and their families, I know how you feel. I also lost my uncle at the young age of 51 in intensive care when I was a teenager. He died in intensive care because he had cardiomyopathy. I felt the pain you are experiencing currently as a family member myself, within my own family, as well as having decades of experience as an intensive care nurse. I know how you feel going into intensive care and seeing your beloved mum, dad, wife, husband, son, daughter, sister, brother, grandmother, grandfather, niece, nephew, aunt, or uncle suffer during what is one of your biggest ordeals and challenges in your and your family's entire lifetime. Your critically ill loved one is hooked up to machines, monitors the ventilator, often has a breathing tube, and is most likely in an induced coma. The alarms are going off left, right, and center, and it all doesn't make any sense. Your loved one is looking different to when you last saw them a couple of days ago, and you know your loved one is in dire straits. What do you do? What do you say without looking stupid in front of the doctors and the nurses? What is going to happen next? Is your loved one going to survive? What do all the numbers on the monitor mean? Why is the monitor still alarming? Why is the nurse so calm even though the alarms keep going off like mad? What does it all mean? Why is the ventilator beeping while mum is coughing? You don't know what you don't know, and the intensivecaresupport.org membership is going to change all of it for you fast. Did you know that studies and research suggest that a change in the health status of a family member is right in the top 10 of the major stress factors in life? Imagine that. A change in the health status of a family member is right in the top 10 of the major stress factors in life. It doesn't mention critical illness or intensive care. It just says a change in the health status of a family member. That could be anything. It could be a flu, it could be a mental illness, it could be a broken leg. It doesn't mention intensive care, it doesn't mention critical illness, and it doesn't even remotely mention difficult, challenging, literal life or death and critical situations where you and your family really don't know what to do, such as when your critically ill loved one is very unstable and in a very critical condition, or your critically ill loved one is in a life-threatening situation, or your critically ill loved one is in intensive care for long-term treatments and long-term stays, or your critically ill loved one is having a severe or traumatic head or brain injury, or your critically ill loved one is threatened with an NFR, which stands for not for resuscitation, or with a DNR, which stands for do not resuscitate order. Or your critically ill loved one is in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment is, quote unquote, in the best interest for your critically ill loved one. Or your critically ill loved one is approaching the end of life in intensive care. Now, how do those situations that I just mentioned compare to a major stress event in your life, such as a change in the health status of a family member? A change in the health status of a family member sounds pretty benign to me compared to situations where your critically ill loved one is in intensive care, literally fighting for life. The good news is that all of the above situations are manageable with the help of an amazingly supportive, nurturing, positive, persistent, and insightful intensivecaresupport.org community. Let's zoom back into your reality for a moment. Here is what you're probably going through at the moment. The doctors and the nurses told me that my mum will have a CT scan of the brain tomorrow. And they have also told me that she had a chest x-ray this morning, which didn't look too good. They also told me that mum can't come off the ventilator and that she can't breathe on her own. I feel totally overwhelmed by all of this, and it all doesn't make sense, and I don't know where to get help or what to do next. The doctors just came in for their ward round to examine my mum, and they were mumbling things to each other and to the nurses, and they asked us to leave the room. Really? What do they think? What do they have to hide? Can't we stay? What's wrong with these people? This is my mum, and I want to be with her in this difficult situation. Why can't these people just listen? I haven't slept properly for 3 days, and I haven't eaten properly because I've just been in the ICU for most of the time to be with mum. I'm absolutely exhausted. I don't seem to get to the answers that I need. The doctors and the nurses have been very vague with their answers to my questions, and they have been very guarded as well. Maybe I'm not asking the right questions in the first place. A couple of days ago, they have told me that they're trying to wake up my mum from the induced coma, and they are trying to get her off the ventilator, and now they're telling me she's not waking up. She doesn't look comfortable, Can she hear me when I'm talking to her, even though she's in the induced coma? It's been a hell of a ride and Mum is still not waking up. Now the doctors and the nurses are telling me that if Mum hasn't woken up by tomorrow, they need to do a tracheostomy or stop treatment and pull the plug. Are they crazy? What do I do next? Do I consent to a tracheostomy to stop the doctors from pulling the plug? And what about the rest of my family, my dad and my brother? What do they think? Okay, let's zoom out of your reality again. But this is most likely how you and your family feel, because you don't know what to do when you have a loved one critically ill in intensive care. Me, my team of critical care nurses and other families who have been where you are now can help you fast. I can get you in a safe, positive, nurturing, insightful and persistent place where you and I, together with other families in intensive care who are in a similar situation than you are solving your problems and help you to make informed decisions, get peace of mind, control, power and influence, and help you to make decisions that are genuinely in the best interest for your critically ill loved one. Are you and your family sick of the negativity and the doom and gloom of the intensive care team? Are you and your family sick of trying to avoid, to the intensive care team to avoid your questions? Are you and your family sick of looking for answers and you can't get them? Are you and your family sick of the doctors and the nurses trying to, quote unquote, play God and decide over the fate and destiny of your critically ill loved one? Are you and your family sick of feeling helpless and out of control? Are you and your family sick of not knowing what to look for and not knowing what questions to ask? Are you and your family sick of feeling pressured by the intensive care team? And are you and your family sick of not knowing how to manage doctors and nurses in intensive care? If that's how you feel, then I have good news for you. Because here at the intensivecaresupport.org membership forum for families like you who have a loved one critically ill in intensive care and who don't know how and where to get professional help fast. Therefore, in the intensivecaresupport.org membership, you will be surrounded by myself, my team of experienced intensive care nurses, and by my like-minded families who all have one thing in common. They all want the best outcomes for their and for your loved one in intensive care. You will get one-on-one hand-holding from myself. And as you remember, I have nearly worked in intensive care for 20 years in 3 different countries. I also worked as a nurse unit manager in intensive care for over 5 years. And therefore, I have a lot of experience and a lot of insights into the intensive care world that go way beyond the bedside nursing. I literally worked with and looked after thousands of critically ill patients and their families inside and outside of intensive care. I also consult and successfully advocate for hundreds of families in intensive care with my one-on-one consulting and advocacy service for families in intensive care here at intensivecarehotline.com. As part of your membership at the intensivecaresupport.org, you will also get professional help from a team of experienced and caring ICU nurses who help and guide you to steer the difficult, dynamic, highly political and volatile territory that is intensive care and ICU. By investing only 30 minutes per day to get the outcomes, the care and the treatment that you want, need and deserve for your critically ill loved one. Because in the intensivcaresupport.org membership, I will personally handhold you through this difficult, often traumatic, emotionally draining, and also once in a lifetime experience that you know you can't afford to get wrong. The intensivcaresupport.org membership is a genuine online support and resource center for families in intensive care, and here is what you get 24 hours a day, 365 days a year when you sign up for it. Daily questions answered by myself personally and by my team of experienced intensive care nurses. Your private one-on-one consulting section with myself, and this alone is valued at over $1,000 per month. You will get 24/7 online support from other like-minded families in intensive care who all have one thing in common. They all want the best care, treatment and outcomes for their loved ones in intensive care, and they all share their experiences. You will get 24/7 support from ICU nurses who really care to help you get the outcomes, care and treatment you know you and your family want, need and deserve. I will also run weekly webinars to get your questions answered on a live call. And again, this alone is valued at over $1,000 per month. You can get access to the intensivcaresupport.org membership for families of critically ill patients in intensive care here for only $97 per month or for $7.99 per annum. You will also get help and advice from professionals and individuals who have had the same or similar experiences. You can make informed decisions even in the most complex situations. Get understanding and support from a community of like-minded people. You also get help with legal advice. Get all of your questions about your critically ill loved one's condition answered. How to ask the doctors and the nurses the right questions. How to interpret diagnosis and prognosis. How to get best care and treatment irrespective of your critically ill loved one's real or perceived prognosis. Most importantly, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. You will also learn how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence fast in your situation. You will also get lots of real-world examples that you can easily adapt to your and your critically ill loved one's situation. You will also learn how to stop being intimidated by the intensive care team and how you will be seen as equals. And you will also learn how to turn the tables in your favor. You will also get that crucial behind the scenes insight so that you know and understand what's really happening in intensive care. You will learn how to respond to the pressure from the intensive care team to agree to things you don't want to agree with and how to turn the tables around. And how you need to manage doctors and nurses in intensive care, and it is not what you think. You will also get intensive care insider updates every month straight from our research department to get you to the outcomes you want for your loved one. You will get complex medical terminology explained, how to interpret what is exactly happening in intensive care, how to successfully interpret the politics in intensive care and how to use it to your advantage, and how to successfully advocate for your critically ill loved one. How to successfully negotiate with intensive care teams even if you're not a doctor or a nurse in intensive care. You will learn the secret intensive care language into plain English even if you're not a doctor or a nurse in intensive care. We also have a glossary section and dictionary for medical and intensive care terminology. Advocacy training modules, how to be in charge. This section alone is valued at over $500 because you have access to all of my best training, videos, audio recordings, and insider material. But it gets better. How to successfully reverse unilateral NFR, not for resuscitation, or DNR, do not resuscitate decisions by intensive care teams. And you will find proven strategies to reverse them. And this alone is valued at least $1,000 alone. You will also learn how to successfully reverse unilateral withdrawal of treatment decision makings by the intensive care team whilst getting best outcomes, care, and treatment for your loved one, despite the intensive care team wanting to, quote unquote, pull the plug. And this technique and strategy alone is valued at $5,000. You will get online resource center and support. It's a hand-holding type of community where myself, the experienced and caring ICU nurses, and other like-minded families will hold your hand every step of the way, 24 hours a day. Invest only 30 minutes to an hour per day for best results. How to easily seek through medical information and ICU terminology. How to wean your loved one off the ventilator and the breathing tube, and you will get best practice guidelines. You can also learn how to successfully wean your loved one off the ventilator and the tracheostomy. Again, you will get access to best practice guidelines. You will also learn how to decide when and if your loved one needs a tracheostomy or not. And again, it's all based around best practice guidelines. How to successfully avoid long-term acute care or LTAC, also skilled nursing facilities, and stay in intensive care for best outcomes. Again, we have best practice guidelines around this. If you send your loved one into LTAC or long-term acute care, or even worse, in a skilled nursing facility, if you do that, you've literally signed the death sentence for your critically ill loved one. In the intensivecaresupport.com membership, I'll show you proven strategies how to keep your loved one in intensive care for as long as they need it, instead of going to an inferior LTAC facility where patients and your critically ill loved one will be destined to die. You will also learn how to find out if your loved one is dying or surviving. How to effectively deal with death or dying when the inevitable happens. When and how to agree to family meetings with the intensive care team. How to have it on your terms, and how to successfully negotiate the outcomes you want in those meetings. You will also learn how to get end-of-life situations on your terms. You will also learn how to successfully manage difficult family dynamics during a time when your loved one needs unity for best outcomes, care, and treatment. You will learn how long it takes for your loved one to really wake up after an induced coma and how to manage it. Again, you will get best practice guidelines. How to develop patience, stamina, when your loved one is not waking up after an induced coma. How to stay positive during your loved one's ordeal in intensive care. You will learn how to fight and deal with negativity and the doom and gloom mentality from intensive care teams. You will learn how to help your loved one when they are not waking up after a traumatic brain injury. And again, you will get best practice guidelines. How to help your loved one when they are not waking up after an hypoxic or anoxic brain injury. Again, you will get best practice guidelines. How to successfully negotiate with health insurances to extend your loved one's ICU stay whenever clinically necessary, even if you think there is no funding, or even if they told you they will stop paying. You will also learn how to get intensive care at home for your loved one, even if you think there is no funding. And again, how to manage doctors and nurses in intensive care, and it's not what you think. You will be able to manage even the most horrible ones after you've signed up for the intensivecaresupport.org membership. You will also have access to over 20 ebooks that I normally sell for $27 each, and they also come with videos and audio recordings and hours of insider knowledge. And again, that's valued at least at $500. As a member of the intensivecaresupport.com community, you will also get a 20% special discount for one-on-one access to me over the phone and one-on-one consulting and advocacy for me over the phone. You will also get a 20% discount if you need a review for medical records. Here is also what some of our clients say. You will get insights, information, and support in a very difficult time, help to prevent premature cessation of treatment for our loved ones. Patrick or his qualified professional team can talk to the doctors and interpreting what they are saying and what all the jargon and numbers, etc. mean. The complicated terminology and reasons why things are done the way they are in intensive care, all explained for you in simple, plain English. You will get info on how intensive care really works and how to deal with a traumatic experience in the best way possible. Make the right decisions in any situation for your critically ill loved one. Therefore, for only $97 a month or $7.99 per annum, you get access to a worldwide and like-minded community where you get help, insights, results, and support fast by professionals and other like-minded people who understand you and your difficult situation. No waiting for the intensive care team who is quote-unquote busy or is pretending to be busy. You will get help now. In the intensivecaresupport.org membership, you get access to people who know and understand how you feel and who help you get the results that you want fast. You can use the intensivecaresupport.org membership from the comfort of your mobile phone, your tablet, or from your laptop, no matter where you are. Rather than sitting in the waiting room in intensive care or at your loved one's bedside looking for answers and not finding them, have all the answers you are looking for at your disposal in the click of a button. Be one step ahead of the intensive care team and get yourself an unfair advantage in this high-stakes game. that usually only the intensive care team knows how to win. The good news is that with the intensivecaresupport.org membership, you will be getting results fast because you will know and understand everything that's happening in intensive care at lightning speed. By being a member at intensivecaresupport.org, you will get a real edge and an unfair advantage, and the intensive care team will know and understand that you know and understand everything that's happening in intensive care. By being a member at intensivecaresupport.org, intensive care teams know you are talking to a real professional who understands intensive care inside out, and therefore the intensive care team can't hide any longer from you. As a member of the intensivecaresupport.org community, you will also get a 20% special discount for one-on-one access to me over the phone, plus a 20% discount if you need a review of the medical records. Get access to the intensivecaresupport.org membership for only $97 per month or $7.99 per annum. You can cancel your membership at any time just by you sending an email to support@intensivecarehotline.com. Have a look at what some of our clients tell us. My daughter was in ICU a few months ago. It was then I needed and sought help. It was invaluable. From Mani. I am very lucky to have my loved one recovering well, and I was empowered by reading your advice and speaking up. It made all the difference in enabling me to advocate for my loved one and not give up. P.S. I ended up doing some of my own research about therapeutic hypothermia treatment that was used. From Teresa. I thought the website and the membership, as it was immensely helpful, helped to hear about other families' experiences, and I could relate to my own. Thank you so much. From Christina. I am so glad to have you out there, and I feel I could reach you when suffering with the situation. I wish there were a way to have a proper real end-of-life planning that was not in hospital now. My parents are very old. We were late in life children. What do we do? Many cave to hospital quickly. A doctor friend said, make sure she has end-of-life plans. She has her trust and healthcare directives, etc. But those are broad terms, doesn't describe how to fight hospitals and how to know if they want your ICU bed. Maybe there needs to be a separate plan. If they just need my ICU bed, do the following. Those kinds of things are not in the healthcare directives, especially when you have uninvolved brothers and sisters saying, how about comfort care out of nowhere? From Emma. Patrick advised us step by step how to keep my dad in ICU and avoid LTAC or long-term acute care as well as nursing home. With his help, guidance, tireless advocacy, insider knowledge and compassion, we got our dad off the ventilator and the tracheostomy in ICU, and now he's home. Without Patrick's help, he would have ended up in LTAC and he would have died. From John. So get access to the intensivecaresupport.org membership here for only $97 a month or $7.99 per annum. So thanks again for watching, and I'll see you inside the membership. Take care for now.